Good afternoon, ladies and gentlemen. I have less than 5 minutes, as you heard, so straight I'll go into my brief presentation. There is very little published literature on patients already on ART who are developing TB. In our HIV program, we looked at patients who are developing TB and trying to categorize at what stage they are developing the TB. And we had in mind the pre-ART phase, the IRIS TB phase, that's within 90 days of starting ART, they develop TB, and then beyond that. The aim was to better understand the timing, as I said. And we used the retrospective cross-section design. We looked at the high volume sites where we're getting most of these new TB cases for the period under review. And we had 12 sites. And then the period of review was between 2011 and September 2012. We collected data from TB cards, TB registers, ART registers, and patient files. And then we used the Wilcoxon rank sum test analysis to measure differences by comparing the median baseline CD4 counts for the different groups. So in terms of the results, out of the 446 patients, 404 patients fitted in these three categories. So we had 142 patients, about 31.8% in the pre-ART group. The IRIS TB group was about 18%, about 80%. And those who developed TB beyond 3 months of being on ART were 40.8%, about 41%, about 182. Majority were males, and most of the TB types was pulmonary in nature, 86%. The median age for starting TB treatment for the whole group was 37.7%, and the median CD4 count for the whole group was 205. So the results are summarized in the pie chart. What is important there to notice is that the median baseline CD4 count for the three categories was lowest under the pre-ART, which had a 150 CD4 count, followed by the IRIS TB group at 159. And the patients on ART were developing TB at a higher CD4 count median at 236. And when we compared the differences, we found that it was statistically significant between the ART groups and the other two groups, the pre-ART and the IRIS TB groups. We had an incidental finding of about 10% of patients who had TB were eligible for ART, but at the time of data collection had not yet been started on ART. So in summary, what we're saying is TB in patients already on ART is quite common. In our evaluation, we found about 40%. And also we found that TB for patients on ART develops at a higher median CD4 count compared to TB in pre-ART and IRIS TB. We are recommending that a prospective research is done to better understand the implications of this finding, because this was a retrospective study, observation in nature. Thank you.